Hey pole dancer, welcome to the Evidence-Based Pole Podcast. My name is Rosie Boa. I'm a pole dancer, pole teacher, and personal trainer. And I've started this podcast so that we can learn together, talk with the experts, read the research, and feel better on and off the pole. So if that sounds like something you're interested in doing, let's go. Welcome. Today we are joined, I'm very excited, by Dr. Angela Prescott, Angie, who you may know as Acro PT. So I thought, first of all, PT, I should say really quickly, in this case is physical therapist and not personal trainer. They're both a bridge to PT. They are different. I am the personal trainer type, not the physical therapist type. So what is, for those folks who may not be familiar or maybe from overseas where they're called different things, what is a physical therapist?
Well, it will depend on who you talk to. Unfortunately, it's much like the personal training profession. It is a varied profession, right? Lots of specialties, lots of levels. I got into PT particularly to become a movement and rehabilitative specialist. So what I do in practice is look at what somebody presents with, look at what they are trying or attempting to do that is limited by their presentation, and then work backwards as if I'm reading a book in reverse to get them back to a more anatomical and biomechanical norm. So anything that falls under that realm, whether it's exercise, manual therapy, which is like hands-on massage, alignment-based work, dry needling, right up through neuromuscular re-ed and retraining to get that movement pattern restored and to address the compensation. That's kind of my summary of physical therapy in this realm.
And the reason why I asked you to come on this podcast in particular, and people may have deduced from the name Acro PT or being familiar with your work, is you specialize in circus artists and pole dancers and aerialists. So what are some things that, you know, folks, I mean, it's a pole dancer podcast. What should pole dancers be thinking about? And maybe what are some signs of like, maybe you should see a physical therapist. Maybe it's time to bring in a professional.
Yeah, absolutely. I got into this type of PT because I've been studying gymnastics, acrobatics, circus, and even pole since I was about 9. I progressed through traditional gymnastics, dance, probably like many pole dancers as a kid, got into college, switched from competitive to circus arts, got into circus arts, which was like a great gateway drug into aerial arts. And then that led me to pole. And I was working as a PT in a Muggle clinic for many years. And I say Muggle, not that there's anything wrong with them, but it was not as much fun and not as interesting. I was coaching a circus team at the University of Maryland called Gymkhana, and I was serving as their trainer. So I was taking my PT knowledge, volunteering as a coach with them. I had been a member as a student and treating their injuries. And what I was finding is I would treat them in the gym and then send them to a local PT because I worked at a clinic that was too far for most students to travel. And they would get sent immediately back, and someone would say, "You're perfectly flexible. You're super strong. And you only have pain when you do gymnastics. So maybe don't do that because you're over 16. And so when a polar presents with pain that is not delayed onset muscle soreness, so this is the pain that comes on while you're poling, immediately after, and eventually starts to affect things like your day-to-day life or limits your progression in pole, that's when you want to get somebody else involved. And you don't want to take no for an answer. If you talk to someone and they say, "Oh yeah, the solution is you shouldn't be doing that," that's such an easy out. It's a cheat. There are good PTs out there and there's good movement specialists out there who will find that dysfunction and address it. But yeah, if you're having pain right away, pain during, or pain that affects your day-to-day, get help.
That's so patronizing too. Like, I'm going to tell you, an adult, what you are and aren't allowed to do with your body, and I'm refusing to help you with the problem you came to me with. A good litmus test that I'll use as well for my students and myself, I'm actually really sore today. I went too hard yesterday, is, does it get better with gentle movement? And if it doesn't, then that's also like a little red flag for me. They're like, maybe stop doing the gentle movement and talk to somebody else.
Yeah, no, gentle movement's super helpful. Muscle soreness gets better with movement, gets better with time, gets better with hydration and protein. Pain gets worse with movement, stays or gets worse with time, and is unaffected by your nutrition, rest, and hydration level. So.
And for the people who may not be familiar with physical therapists or, you know, your qualifications or education, what are some things to look for? Like, what are some things that you did in your training? I'm assuming that you can't just like walk in off the street and be like, now I'm a physical therapist because I also have a body.
Well, yeah, no, I mean, hopefully not. If you catch somebody doing that, you might want to not only leave, but make a note to somebody else. PT in the US is currently a doctoral level education. So you've got to go through undergrad, and usually there's additional prerequisites. And then you go on to get basically a clinical doctorate, which is a professional doctorate. It's a DPT here in the US, similar to like an MD or like a, doctor of chiropractic or whatever you're looking at. So for most people, that's like a 7 to 8 year educational course. And that makes you really good at absolutely nothing when you graduate, because you've just finished a very broad training and educational program. So if you are looking for a good PT, you want to look at what their additional trainings and certifications beyond that DPT are. You're looking for things that are manual therapy based, especially for pole athletes. They respond exceptionally well to hands-on work and hands-on assessment. So you're looking for certifications and training in manual therapy. You might, depending on your state, be really interested in looking at dry needling. Some states allow dry needling, which is a type of neuromuscular rehab that is not acupuncture. PTs cannot provide acupuncture, but they can dry needle. And you might want to also look at the PT's hobbies, backgrounds, and interests. There's a lot of certifications on movement, so like an FMS screen, or somebody that's got a CSCS, a personal training background, and a PT, because they're going to have a love of fitness that will align with your goals. And that's kind of what you want to focus on.
Yeah, definitely. Because especially, as dancers, we want to do things that are well above walking around and living our day-to-day life with our bodies.
The average PT is going to be looking at things from what is considered average range of motion or average strength. So you think of average range of motion, if you were looking at hamstring flexibility in somebody off the street, they would be able to lay on their back and they would raise their leg basically, up to 80 degrees. So that would be considered good enough, right? So that person is cleared from PT to go about their day because their hamstring is fine. But a pole athlete, for even something like an inside leg hang, is going to need about 100 to 135 degrees of hamstring extensibility. Otherwise, they're getting it from somewhere else. And so they're going to get hurt, miss class, have to take time off, that kind of stuff.
Definitely. So specialist who's familiar with what you're doing and can help out. And speaking of specialists who are familiar with what you're doing, I know you have a workshop coming up at PoleCon.
I do.
This episode will definitely go out before PoleCon.
Yay.
And the focus is something that I'm very passionate about, and that is thoracic mobility. I'm pretty sure thoracic is one of those things that's really hard for me to spell, but if people want to look it up, it's THORACIC.
Yep, exactly.
Did it. Take that, dyslexia.
Nice.
What
and on screen,
The pressure.
So, yeah, the thoracic spine it's a long forgotten part of the back, which is unfortunate. And I think that's because it tends to be asymptomatic. So it is the problem you don't know you have because it never really complains. It generally doesn't refer pain in the sense that it is the primary cause of pain. And you can get by with a lot of restriction because your thoracic spine is basically all the vertebrae that run from right between the top of your shoulder blades down to the base of your rib cage. So there are 12 thoracic vertebrae. To give you some context, there's 7 vertebrae in the neck and 5 in the lumbar spine. So the 12 thoracic vertebrae actually make up the bulk of your spine, but all of them are connected to a rib on both sides. So generally we think of them as part of the rib cage or part of the thorax. And we don't give credit to just how much that matters in neck motion, shoulder motion, back motion, and hip motion. Our thoracic spine robs us of a lot of mobility that we then try to cheat, getting in our neck, getting it in our shoulder, getting it in our low back. And that's actually the parts that get injured. And they're the parts that give you information and signal about pain. So you tend to sort of diverge off this path looking at neck, back, hip, shoulder, and you miss the original source of pain, that thoracic spine.
Yeah, something just off the top of my mind that I often see in students is if you're working on Superman and it feels like an enormous chest stretch and you're really, really struggling to reach the pole, something that can be an issue is if you have a hard time rotating side to side, especially from that middle back, it can be really hard to reach the pole. But if you work on that, students who have worked with me know that I have like a series of exercises in Cobra I really like that are wonderful. They're so good for you.
I mean, it's effective. Huge. Thoracic spine mobility is probably the single biggest limiting factor I see in students who are struggling with things like pull-ups, inability to do basically twisted grip or any type of elbow hang, something where they're using a behind the back grip or any type of variable grip. It usually comes out as a shoulder pain or a strength issue, and that's what they feel. But it's actually because they're not using their thoracic spine in that movement pattern. So their shoulder blade's locking up, their rotator cuff is under tension, their grip is overused. And, obviously lots of pole instructors will notice this. And the hard part is the thoracic spine isn't pole's fault, right? It's actually the desk job, the sitting, the day-to-day stuff, the driving, the Netflix. It's everything we do where our thoracic spine is this rigid base. And then you go to pole and it doesn't allow you to have a thoracic spine that's like 60% healthy. It wants all of it. So you'll go to a professional and they'll say, oh, this is a pole dancing injury. It actually might be a pole dancing diagnostic. So your thoracic spine problem probably has been with you since the first time somebody made you sit in a poorly designed desk in middle school, you know.
Wow, those the ones attached to the chair where you like,
Yeah, and heaven forbid you were left-handed, like turning diagonally across to that right-sided desk.
So besides, general shoulder pain, rotator cuff pain, what are some signs that the thoracic spine may be a limiting factor for students?
Okay. Yeah, so what I tend to see is a lot of perception of neck tightness. So a student will come in and say, after training shoulder mounts, after doing some inversions, not only was my neck sore, but it felt tight. Like I turned my head and I felt a strong pulling on the left side. I wasn't able to side bend, or I had a hard time sleeping because I felt like I couldn't get my neck to relax. And generally, those are all an indication that your neck compensated or moved too much. And so you perceive it as a stretch, which makes you think your neck is tight, but it's more likely that your neck is telling you that it is being asked to stretch too far. So it is feeling the sensation of stretch, not because it's restricted, but because it's overworked. And the restriction comes from this portion of your thoracic spine right between your shoulder blades, not moving at all. So all of the muscles in the neck that run down and attach into the scapula or right into the junction of the cervical and thoracic spine got really overworked during pole. So that's a huge indication. People with chronic headaches, especially being female in the pole world, we get sort of like shoved off as saying, well, that's stress or hormonal. Even the most hormonal of headaches tend to have an underlying musculoskeletal component, and we call that cervicogenic headache in the field. So don't just write it off as exclusively a cyclic thing. Check out the T-spine.
Yeah, there's always a reason you have a headache. Something my neurologist told me.
Yeah, and they can be multifactorial. So you'll have somebody that has a little bit from every jar, but if you ignore that musculoskeletal component, the meds won't be as effective, that kind of trigger. The other thing I see a lot in thoracic spine dysfunction is numbness in the hands. And a lot of people will assume immediately it's carpal tunnel, so they'll assume it's a grip issue. But the way your thoracic spine moves and exists, all the nerves that exit the neck run down underneath your clavicle into the front of your shoulder and down the arm. So they have to basically pass adjacent to the thoracic spine, and they run behind your pec minor in the front, and they run in front of a muscle called subscapularis, which runs inside your shoulder blade. It's a rotator cuff muscle in the back. And all of those sit and sort of sandwich the rib cage. So if there's any thoracic dysfunction, they're going to be tight. So they're going to compress those nerves. And no matter what you do as far as wrist or hand stretching, hand strengthening, neck stretching, you're missing this whole quadrant right in here. And that's usually an indication that your mid back is tight.
So what are some things that you can do to work on this? And, when we're talking about mobility, what are the specific directions of movement that tend to be more challenging for folks? Because usually rounding forward in the thoracic spine is not an issue for people in my experience. We're really good at it.
Yeah, no, and we're great at it. And we're good at it because we're good at engaging the anterior chain. So think of all the muscles on the front of the chest, abdominals. Everything we do in this position, this rounded position, we do over and over again, and they're super well engaged. So we are great at forcing flexion. We're not really good at elongating or eccentrically creating it. So our paraspinal muscles in the thoracic spine tend to be really tight. So they don't actually allow for flexion. They just get overpowered by the anterior chain muscles. So people, will assume, well, I don't want to, practice flexion motions because I am going to be reinforcing a negative posture, but rather you should be just not using the wrong muscles. So that's something to kind of talk about. That's like the cat-cow and the warm-ups you do with your students where you're getting them in flexion, but you're pressing through the thoracic spine rather than pulling into that position. Rotation is probably the single most helpful thing you can do for your thoracic spine. The reason for that is flexion and extension, so rounding and arching, are basically true motions. So both sides of your vertebrae move forward when you flex, and both sides move backward when you extend. When you rotate, it's an alternating movement. One side goes forward, one side goes back. And so like switching the opposite happens. If you train rotation, you're training a little bit of flexion and a little bit of extension. So you're really going to see the biggest bang for your buck if you do rotational movements rather than just extension movements. Because like you said, extension's really hard. We're always pretty flexed. So I give most of my patients a lot of rotational work. So tons of examples of exercises, but even something as simple as laying on your side with your knees tucked up and then just opening your shoulders and looking to the ceiling. So locking up your hip in a way that your hip isn't rotating with you and just opening the chest to get that rotational component is probably the most helpful exercise, you can do without any training. The other thing you should think about is breathing. A lot of us breathe exclusively in our upper chest. That's a combination of a few things. One is habit. Most women grew up in like a world that dictated a flat abdominal area, so flat stomach, open lifted chest, boobs forward was the way we wanted to be. But that means you can't breathe with your diaphragm. Your diaphragm basically forms this sort of top component of your abdominal cavity and the bottom of your thoracic cavity. So if it's not dropping down and pushing all your abdominal contents out and forward, then it's not actually stretching any of the fascia on the inside of your rib cage. So your diaphragm not moving can lock up your thoracic spine. Most people have heard of belly breathing or crocodile breathing. That's a huge help in getting your mid-back moving again, because it's starting to pull on all those deep fascial connections with the rib cage. And in pulling on them, it allows more movement in the thoracic spine over time. So something like doing some deep belly breaths, trying to breathe into your sides, or trying to breathe into that lower thoracic spine, combining that with some sideline rotation, can actually take you pretty far into fixing your own problem.
That's something I'm happy that you said that, because now something to point my students to is that every class we start with breathing exercises, and I know they're not always the most exciting thing in the world, but it really does help. And particularly when we're getting upside down, right? If you are at the point where you can, intentionally, find that breath with your belly, and then unintentionally find that breath, then when you're upside down and you're under a lot of tension, you're thinking about other things, you're still going to be breathing normally, and it'll make your life easier and you won't get lightheaded, ideally.
Yeah, absolutely. And I mean, how you breathe is going to shift based on what muscles you're working. So practicing breathing differently, doing it when you're right side up, much, much safer than learning how to do it upside down for the first time. So that's awesome. There's so many instructors that I have met with that have just never considered breathing. So your students are super lucky. Like they don't even realize that they're not winded because they're out of shape. They're winded because they're not breathing right. Like they're giving themselves a third of their breath, not a full breath. When you're out holding an Aisha, you should be able to breathe. Like you're not going to hold that very long if you're, lacking oxygen, for example.
Yeah, absolutely. Absolutely. And one of the things that I, put up there as a goal for my students that we were working on last month actually was, can you hold a leg hang for 30 to 40 seconds? If you're not breathing, the answer is going to be no. It is important to breathe.
Yeah, it's huge. And I mean, a lot of thoracic mobility restrictions are coming from basically poor breathing. The other thing I see, unfortunately, in women too, is we are always in a bra for work, for training, for otherwise. And right where that bra strap falls is just below the shoulder blades. And it's in such a way that it actually creates this tension or restriction on sort of the rib cage right at the base of the sternum. And we get used to that restriction. So we actually stop by the time we're in our 20s, 30s, trying to access breath there. So, anytime someone's dealing with neck pain, shoulder pain, or low back pain, I tell them when they're at home, when they're not wearing a bra, work on breathing then. Because if you train it while you're sitting at your desk at work, you might be missing this little section.
Definitely. Doctor's orders. No problem. Whenever possible.
Yeah, if we could just get rid of them, that would make PT much less necessary. So, I feel like maybe there's something going on here that we're not aware of in the capitalist society. Maybe there's some PTs that are okay with bras. But yeah, they create such a dysfunction, and you can just actually see it in the tissues. Like you'll actually see fascial restriction on a patient and know what type of bra they've been wearing for 20 years.
So you've mentioned fascia a couple of times, and I think that might be a term that not everyone's familiar with. So what is fascia? Yeah. Also, if you could spell that. I think it's, let's see if I can go 2 for 2. F-A-S-I-C-I-A?
Just F-A-S-C-I-A.
Dang it. F-A-S-C-I-A.
You're close. Yeah, amazing. Because it is theoretically the structure that connects all components of our musculoskeletal system. So obviously everyone's seen a skeleton, at least for Halloween. Everyone knows that muscles attach from one point on a bone to another point. Muscles cross at least one joint. Sometimes they can cross 2 joints. Fascia is really interesting because not only does it cross joints, it crosses muscles, and it goes between and around and through muscle layers. So if you've ever cooked chicken and you've been trying to pull apart chicken breast, and you are noticing that there's this white, sinewy, sort of grippy piece that rips as you tear it apart, that's actually fascia. So fascia is little bits of connective tissue that are holding things together. There are different thicknesses. So there's really strong fascia. The one you might be most familiar with is IT band. That is a type of fascia. It's a connective tissue. That one doesn't stretch at all. It has very little movement or other components. And it tends to, be something we use for support when it's that type of thickness. But there are other parts of our fascial system that we use for movement. Fascia can actually contract and relax. There are some muscular components to it. And it can actually lengthen over time with repeated training and stretching. It doesn't get longer. It just reorganizes. If you think of it as cobwebby in nature, you can actually train that sort of varied angle of tissue to something more linear with stretching and repeated movement. So fascia is very, very modifiable, and it's really neat. If you get a chance and you want to Google like cadaver dissection, or if somebody's not like creeped out by it, you'll actually see tons of it. It is something that is very, very visible in the body. And without it, we would not be able to coordinate multiple segments of movement. So fascia is what makes, your single arm hangs possible, not because it adds a strength, but because what it does is provides feedback over multiple muscles in a way that your body wouldn't be able to coordinate that with.
Yeah. I remember, because my early introduction to anatomy, I think most folks was, those anatomical diagrams like you have in your high school textbook, and it's always like, here's the circulatory system and it's completely separate, and here's the muscular system, it's completely separate. And then when I started watching cadaver dissections, I was like, oh, there's a lot of fascia, and it doesn't show up in those diagrams, and until you have, more information, you may not realize just how much of it there is.
Yeah, it's neat too, because fascia actually runs between organs systems. So your abdominal fascia isn't just for your abdominal muscles. It can actually run underneath your digestive tract. Your psoas, which is a hip flexor, most students in pole have heard of the psoas. It shares fascia with the posterior digestive system and some of the reproductive and urinary organs as well. So if you have fascial dysfunction that is because of hip flexor or abdominal or even pelvic floor problems, you actually might also have digestive problems related to that fascial issue. You might have breathing problems, and they're all connected. So your movement on pole may not be as simple as my back is not flexible or my hips are tight. It might be really complicated. And that's where seeing somebody who's done some of that visceral mobilization, that manual therapy side of it can help tease out. It's also a really big issue with somebody that had a surgery. So whether that surgery was, a C-section, whether that surgery was some type of orthopedic surgery or an abdominal surgery, you're going to have scar tissue, which is basically modified fascia. And scar tissue can then bind layers of fascia together that were never supposed to be bound. So now you have loss of motion in a hip or a knee from an abdominal surgery that you had no idea about. So something worth, if you're dealing with that as a pole athlete, talking to somebody and saying, hey, I've noticed I've never really had this hip range of motion since I had that weird abdominal surgery. Or, I had a patient that had thyroidectomy, and she lost almost all of her ability to rotate her shoulder for pole.
Oh, wow.
And it had not a direct connection. All of her pain for pole was here, but this is where the scar tissue began. And she lost so much more of her pole training that she initially attributed to deconditioning from dealing with the issue, but it had nothing to do with that.
And for those of you who are just listening, that was under the shoulder blade.
Yeah. So 9 to 10 inches away and on the opposite side of the body. So it's really neat to think about just how important fascia is. So what's funny is I've been in PT for 19 years now. So since I started working with patients, and 19 years ago, a lot of my anatomy books also showed that complete total absence of connection between the organ systems. So that's why going back and taking more courses is really helpful. So if people feel like they've never heard of fascia, don't worry. There's some PTs out there who probably also have not studied it either.
I think probably the place that polars will have run into the term, if they have, obviously if you have got a medical background, you heard it there, is in myofascial release. So you want to talk a little bit about that? And I know it's one of those things that's not super well studied, but most of the studies, there seems to be at least some degree of effect, and it seems to be pretty consistent in direction, which when you're working within, sorry, this is an aside because I have a background in research, but when you're working in a very understudied area, that's, if there are no, large randomized controlled trials where you're like, okay, we're pretty sure that we've controlled for most of these variables, particularly if pole's a great one here because we are not a huge patient population, and there's just not a lot of research on us. So you read what's available and you're sort of like, okay, is this something that, so this is what I think about in my teaching, if I added this to my teaching, would it be something that had a risk associated with it? If it does, I'm probably not going to do it. If there is no risk, does it seem like there is a benefit? Is it something that I personally have experienced a good outcome for, or students I've worked with have experienced a good outcome for? And then bringing those things together, I'll be like, okay, this seems like something that's probably reasonable, right? A great example is rolling the IT band. I don't think you should do. I haven't seen great results from it. Mostly it seems like it's just painful, and there's not really, again, certainly the way I teach it and have been trained in it, doesn't seem to be a lot of effect. Whereas something like rolling out the booty meat, the back of the butt,
the glutes.
It does seem to have, it feels good for me and for a lot of students, and it does seem to help, find a little bit more movement there. So that's sort of how I make decisions. All of that was to say, I know that there's not that much research on myofascial release, but what do we know? What would you recommend for just like a pole student or a pole dancer to do? And what are some other things that you think about?
Yeah, so like you said, myofascial release has limited research, and that is largely based on the fact that there's limited money to be made in myofascial release. So it's probably not going to get a ton. I will tell you there's lots of good clinical studies, so individual case studies, and that's most of what people should be looking at from a pole perspective now, is finding some situation similar to theirs or something that they are comfortable comparing and seeing, well, it worked for so-and-so, will it help me? Most myofascial release, if you do it right, or even if you do it somewhat wrong, is perfectly safe. So the only exception would be if you are somebody that's grabbing a lacrosse ball and laying on something and you feel a pulse or a heartbeat, please move off it. I had a patient that came to me and said, every time I get my hip flexor on a lacrosse ball, I get a head rush and I feel my heartbeat and it must be working. And I was like, please never do that again. So myofascial release is safe if it is not over an artery, which would be the heartbeat, and if it is not over a bone. And you would know that because we're talking about the bony prominences you can feel. So obviously like your clavicle, your heel bone, you want to stay off things that you're very acutely aware, like your elbow that are bone. As far as everything else, myofascial release works for several reasons. We don't know which one on every person. So I'm sure you've seen it in the literature too. There's lots of theories as to why it works. The most accepted theory is if you perceive myofascial release as less about stretching, so less mechanical, more neurological, meaning you're triggering a sensory response and you're bringing attention to an area of muscle. The hope then is that you're trying to reconnect that brain-body connection. So pushing that lacrosse ball in your glutes, for example, isn't really stretching out your glute. What it is doing is finding points in the glute that are adhered, whether that's fascial or myo, the muscle part, a trigger point or a knot that has been made tight as a protective mechanism by the central nervous system. And you're trying to roll around on that and reconnect the brain to that part of the body and say, is this supposed to be tight? Is this what you really wanted? Is this okay? And it's more like checking in. So if you perceive it as basically getting data for your central nervous system, myofascial release is about re-educating and reconnecting. So much like most of our relationships fail because of poor communication, that is where most of our muscle dysfunction comes from. At some point we strained our glute, our brain said, oh no, I don't want this muscle to rip. Let me tense up the fibers. So it won't be a relaxed muscle anymore at rest. It'll be a slightly tense muscle. I'm going to brace it just in case that force comes back. And then it forgets to check in. And so you keep training, a couple weeks go by, it's still resting at a high level of tightness. It's not elongating when you stretch. It's not contracting when you engage. And it's starting to atrophy. It's starting to go quiet. It's starting to stop helping you. Putting that lacrosse ball in there and rolling on it, giving yourself 1 to 2 minutes, looking for sore spots and trying to basically hold it until the sore spot drops is actually reconnecting the system. And you can make a positive change by doing it that way.
Yeah. And it is, I have heard people say that you are breaking up or like, tearing down the fascia. There's no way you're producing enough force to do that. It's very, very tough. I mean, think about that chicken breast example. If you take that and you just like try to pull it apart with your hands, it's not happening. It is tough.
Yeah, well, it's also something, there's a principle called viscoelasticity, which is basically a fancy way of saying water moves better if you move slowly through it, right? Like, so this is this idea, like if you're swimming, the faster you try to run in water, the harder it is to move in the water. Actually, myofascial release is the same. You aren't trying to like beat your muscle, right? Like you're not trying to push so hard that the pain is unbearable and you think you've won, because your muscle isn't going to respond to that painful stimuli with relaxing. It's actually going to get tighter. So what you're trying to do is just go in and meet it on its level. So if your muscle is pushing with a certain amount of force, you're trying to meet it. Almost think of zeroing out that scale. And you're right, hopefully you're not tearing fibers. That would mean you're probably doing something intensely more aggressive than true myofascial release. You're definitely not stretching or like lengthening them because you're on such a small section, which is why the IT band rolling makes like very limited sense, because that is again a non-stretchable like piece of tissue. When I was doing cadaver dissection, we actually cut one out of the body, and you couldn't do it with a scalpel. You had to do like a bone saw. Like it was so hard to get out. And then we hung it, which I know sounds a little bit intense, but it was just to show the tensile strength, and put like a 35-pound weight on it. And we were asked, how long would you think this will hold? It held the whole rest of the semester. It didn't change length. It didn't rupture. It didn't tear, right? And this is a tissue that is not getting circulation. So you can roll over your IT band all day if it makes you feel good about yourself, but you're right, you're not changing anything. What you do want to think about is your IT band is like a trampoline. It attaches into your glutes, your quads, your hamstrings, the outside of your knee. So if any of the muscles in your glutes, in your quads, and your hamstrings are tight, they're actually adding tension to an already rigid structure. So you'd rather roll around the rigid structure than over it.
Yeah. So I guess in the trampoline example, it would be like stretching out the springs around the trampoline to get more movement.
Exactly. Yeah. You don't want to mess with the bed. It's there for a reason, but you would love to make sure that the components supporting it are doing what they're supposed to be doing.
Yeah, definitely. Something that I'm always interested about is what have you noticed, just like as a professional, is different, if anything, between pole dancers and circus artists and aerialists. And I would say circus artists would be things like juggling, hand balancing, vaudeville acts, etc. Anything where you're not climbing something and going up in the air.
Yeah. Well, it's interesting because aerialists and polars tend to be, aerialists are much more unbalanced than polars.
Oh.
Yeah, I know. Oh, and it's entirely because aerial is largely a pole apparatus. A lot of aerial arts doesn't do a lot of low flow. They don't do a lot of like chair work or other things. Pole athletes tend to, combine spin classes with low flow classes, with inversion classes, with chair classes. So polars tend to get a decent amount of cross training if they're training on multiple types of classes. Aerialists tend to be a little bit more of the I do everything by pulling, and I take 1,000 silks classes. So I see a lot more what they call compensatory bias in aerialists than I see in polars. There are exceptions to that. So I know when someone's training for a showcase or a competition, polars become aerialists in their dysfunction because they're doing the exact same skills over and over again on the same side over, the course of 6 to 10 weeks without training anything else. And so that's something that they have in common when they get to that point. Pole is also a little bit different in the fact that there are not a ton of moments to rest on the apparatus. There are resting poses, but they're based on binds. So more like a yoga bind or something else. You're actually getting into that position and using your isometric contractions or engagement to hold yourself there. Aerial has a lot of breaks where you can wrap the fabric or sit on the trapeze. And so they'll actually need more quick like re-ed. So think of somebody that's like lifting weights and resting between sets is more aerial. Polars are kind of going for like this combination marathon and lift. So they need the cardiovascular and the muscular endurance to hold themselves up for prolonged periods of time. So I do see a little bit more of that need in their training as well.
Yeah, that makes sense. You were never completely relaxed on the pole. You really can't be. Even if you're doing something that, may not be a lot of effort to hold and you're relying a lot on friction, you can't. Don't just let go. Don't just completely relax.
Resting poses are like partially resting poses. So that's one of the things I do see in polars is, they may have a hard time once they've gotten really good at turning on a muscle, turning it back off. So for example, like upper traps, a lot of polars will complain that their upper traps are always tight. And that might, again, be more from their desk job than anything else. But there are very few moments in pole when your upper traps get to turn off because they're either helping to lift you or they're helping to support your head and neck to give you an arch or an extension. So a pole athlete may want to go back and then retrain their upper traps by doing true shrug, right? Giving them fully the on, fully the off, and teaching them not just to be strong in that mid-range, but rather to contract fully and to release fully. So one thing I do a lot of with my pole patients is teach them to elongate a muscle and practice the on and off of that elongation so that they learn to cue down, for example, the adductors between the thighs, to cue down the muscles that bring the shoulder against the side and to cue down those upper traps.
Yeah, I know that everyone has their own fitness goals, and I'm not saying that anyone's fitness goals are bad, but I think a lot of people who come from a place where there's a lot of focus on tone and just like always having a little bit of muscle tension, or like you mentioned, just always trying to suck in the tummy just forever and have that be your natural resting position is just to have like tension in that muscle can sometimes. I'm thinking here about, for example, someone who does like a lot of Pilates, who's really working on like my core never moves. It's always super stable. And thinking that that's like their main goal, but then maybe they want to learn belly dance where it's really important to be able to relax. And for me as a dancer, you know, being able to fully contract and fully relax is like being able to do a full scale, you know, on a musical instrument. If you only have half the scale, you're going to be really limited in what you can do. And eventually you may run into more significant problems down the line, like say pelvic floor dysfunction, particularly if you're like, I'm always clenching, my tummy's flat all the time, which is part of the reason why I love it when dancers are in their dance, take their tummy out and just enjoy it and relax it. And it just makes me so happy every time because I'm like, yes, you're doing a good job enjoying your instrument and having a good time doing it. So just my little aside.
That's awesome. I mean, they're also retraining their body. So it's better for you. Muscles are supposed to work in the whole range of motion. And if it's only working in partial ranges, eventually you will know there'll be a problem, there'll be a pain, there'll be a loss of motion. So yeah, we need to, as athletes, embrace our muscles' entire range of motion. And that means cross training. So if you have the opportunity to talk with your coach and your poler about what they do to cross train, you're probably going to find that your coaches aren't doing exclusively pull, and nor should they be, and nor should you be. The idea of, well, if my studio allows me to take unlimited classes on a membership, I'm going to come every day, 3 hours a day, and do only pull, is going to work for like 5-ish months. And then all of a sudden it's going to shift. So I love more than one training method. And I think that component is more important than we give it credit for, because we love pull. Like, we love circuits, we love aerial, and weight training isn't as much fun. Pilates, yoga may not be as much fun. Walking, dancing, not on the pole may not be as much fun, but those things bring so much more back to our performance and our growth as an athlete.
Yes, my studio unlimited membership includes 2 pole conditioning classes a week. And I focus more on, because I can't expect everybody to have a weight rack at home, right? I focus more on calisthenics, particularly because, as polars, we don't always get a lot of upper body pushing unless it's something we're explicitly working on. And obviously lower body, because we gotta do the lower body. We can't just always be pulling ourselves up and have that be the main focus of our movement. No,
that's awesome. I mean, weights, you don't have to have a whole weighted gym to get everything done. We move our body. The question is, if you move it a lot one direction, did you also move it some the other direction? So I tell people, when you're training your 3 and 4-year-old to learn key life things, you're teaching them about opposites. As an athlete, think opposites. Like, have you done the opposite motion today? If not, ask your coach what that would be.
Yep. Like, if you're training a lot of, pike stretching, for example, or like leg lifts, I would also love to see you do some squats.
Yes.
Just a little bit in there.
Just a few.
Yeah. And it'll, I'm always thinking about, like, I want to be doing this when I'm, 70, 80, and we're going to be able to continue doing stuff by taking care of our body and making sure that we are doing the whole, I don't know, what's it?
Yeah. Basically, aging, it's tough in the sense that, like, we lose some of our peak potential, right? But they've done studies, and, having that research background, you've come across it, that even the most elite of athletes in their 20s and 30s aren't actually reaching their peak musculoskeletal potential, right? So for those of us who are, in fact, just enjoying this recreationally, even if we're losing 5 to 7% of our peak per decade beginning at 30, there's no reason at 70 we still can't perform really well. It just requires us to take care of the whole body, the whole person, and put a little more into it, right? Everything is easy when you're a new athlete. People always assume, well, I felt better when I was younger, but they're also negating the fact that growth as a new athlete is simple, because your skill acquisition comes just bam, bam, bam. When you get a little older, you're now fine tuning, and you're dealing with sort of a stylistic bias. Like, you like certain elements, you like certain skills. And so your training has probably shifted, and you didn't give credit to the fact that that happened. So you may have lost some of the diversity in your training, and that's going to make it harder. It's not that you just got 5 years older. There's more to it than that.
Yes. There's no reason why we can't all continue moving as long as we're able. And we should.
Yeah. I have one of my favorite patients I think she's in her early to mid 70s now. She does flying trapeze. She took a pole in her late 50s just to see what it was like. She does handstands and aerials, and she has aspirations to do all this into her 80s and 90s. And she's infinitely more balanced and fit than some of my 30-year-olds.
There's actually a circus school in Seattle called Versatile Art. Some of you may be familiar with it. And they have every year their Silver Foxes show, which I believe you have to be over 50 to be in. And some really inspiring movers. They were doing it online for a while. I'm not sure if they're still doing it virtually, but maybe they will.
It's awesome. My mom is, in her 70s. My parents' generation has this idea that aging is something you're supposed to do gracefully by giving up on movement and fitness. And, I'm, sitting here at 40, and I think the generation that I'm in and everyone coming up behind me really thinks very differently about that aging component, and recognizing that fitness is actually the anti-aging benefit. Like, if you focus on fitness, you can, sort of maintain a little bit of your youth. So I think it's really cool. I think we should keep encouraging it. I think hopefully people listening to this, if you are in your 40s, 50s, and 60s, like, you're still in the middle of your career, right? It's not the end.
Absolutely. I think that's a lovely note to end on. So before we head out, I mentioned you've got a PoleCon workshop coming up, so folks are going to PoleCon, check that out. But anything else you'd like to talk about, or how can people work with you? I know you do telehealth, which I think may be relevant for some of the folks listening. So do you have some more details on that?
Yeah, thank you so much. Absolutely. I do a lot of telehealth and telewellness, depending on which state you're in, with state practice requirements and things like that. And what I tend to do mostly, even with my patients in Maryland, because I'm located in Columbia, Maryland, so I do a lot of DC, Virginia, New York, New Jersey type people that drive down for an appointment, is I see you and I try to supplement what you're already getting your hands on. So if you're seeing a PT and you're out in, Florida or California, and they're a great hands-on PT and you fixed a lot of what you're dealing with, but you're struggling with this progression from I had pain with day-to-day stuff to getting back into pole, that's where I love to fill in the gap. So I'll take what you're dealing with as a dysfunction, meet with you in a tele-wellness session, talk about your goals and your current limitations, and create a document and some exercises to give to your PT and to give to you, so that you now have a transition, a good way to sort of bridge the gap between PT and the pole studio. Because that, like you said, is not necessarily everyone's wheelhouse. So I do a lot of that. I do a ton of work with inversions, so people are struggling to get their inversions. So a lot of diagnostics on, is this coming from your shoulders, your core, your pelvic floor, your hips? That way I can give them the right exercises to do. I do a lot of handstand work, so helping people figure out balance points and why they can't handle that. And then I do a lot of flexibility work with people through active flexibility. So I don't do contortion. Like, I'm not a big fan of passive range of motion. There's different types of contortion. Won't go into that. But for those people that have always considered themselves more muscular and less flexible, I tend to love working with that population, because it's not that they're less flexible, it's that their muscles have yet to be trained in an active range that allows them to do pole. So these athletes don't tend to get hurt very easily, but they tend to become very imbalanced over time. And once they reach that intermediate level, they tend to slow their progression because their muscles are so restricted. So I love giving those athletes full flexibility in their front splits, full flexibility in their middle splits, because sitting in a split never worked for them, nor should it have. There's other things they need to do.
Yes, definitely. Big fan of active flexibility work.
Yeah.
All right. So, and I believe it is acropt.com. I'll put it in the links. It'll be in the show notes. So check that out if you're interested in working with Angie.
Yeah. At PoleCon, we'll have a booth too. So if someone's coming to PoleCon, stop by. I'll be there treating, because it is in Maryland. So we're doing hands-on treatments. We're doing dry needling. And then I have my medical massage practitioner, Nikki, working with me too. So if you hurt yourself at PoleCon, or if you're flying out and you normally wouldn't get a chance to see me, reach out. We can, schedule a session and even just chat PT, because we're going to be there all weekend.
Fabulous. So folks going to PoleCon, look her up. All right. Thanks so much for joining me today, Dr. Angie.
Thanks, Rosie.
Always lovely to have you. Thank you for making time. And
I really appreciate it.
It was great having you. And it's the end of the show. What do I usually say here? Thank you for listening, everybody. Ooh, it's been a busy week, and it's only Monday. When I'm recording this, it's not going to come out on a Monday. So thank you so much for joining me, Angie. Thank you so much for joining me, everyone who is listening, and I will talk to you all very soon. Thanks so much for joining me today, Pole Dancer. This podcast is a production of Slink Through Strength, the inclusive, evidence-based online pole studio. So if you're looking for a place to train, either off-pole conditioning and flexibility, or learning pole tricks and refining your pole movement, you can find us online at slinkthroughstrength.com.